I've also had patients who had a lot of medical problems going on, who were at suicide risk, who told me and or hospital staff that like, I don't even want to live anymore. And through different time spent with them and different connections and different mental health music that I would utilize and engage with them and build that trust and build that support, they were able to tell me, because of you, I don't want to kill myself anymore. Like I have a newfound reason to live. So that's super.
Oh my goodness.
That's, yeah.
Hello, and welcome to Situaseans podcast. I'm your host, Sean Michael Williams, aka seanydoo. You can call me Sean, seanydoo. Does not matter to me. I'm just glad that y'all are here. And I have a special guest here, and she is also glad that you are here. Who is my special guest? Well, my guest has quite the bio, so I'm gonna go ahead and jump right on in. So my guest, Clare Takash, she has a master's in music therapist, board certified NICU music therapist. And so she started music therapy program at Rush University Medical Center in 2019, shortly after completing her master's degree at Illinois State University, ISU. Let's go. She currently provides individual music therapy services to all adult, pediatric, and NICU inpatient units, as well as group music therapy services to psychiatric units. Wow, go all the way the fuck off. We love that. So Clare received a bachelor in music and music therapy, like we just said, from Western Illinois University, followed by a master's of music and music therapy from Illinois State University. She also completed advanced training at NICU music therapy, NICU-MT. You see, like, again, all of these accolades and all of these degrees and certifications go all the way the fuck off. And she received an additional certification. So Clare is a professional singer and a musician who also plays guitar, piano, and the flute. We love that. And she completed additional coursework in child life, family crisis, psychology, biology, neurology, special education, infant, child, adolescent development. And Clare's prior experiences include working at various hospitals, childhood and adult learning centers, family music classes, and summer camps. Wow, that is a resume, Clare.
Well, thank you. Yes, I've had a lot of different passions and interests that led me to my career. So.
All right. Yeah. Love that. And you know, and again, I got to give you another go all the way the fuck off. And you know what? We're going to go to Plus City a little bit early. Speaking of go all the way the fuck off, get your go all the way the fuck off t-shirt. If you are watching on YouTube or Spotify, you'll see the go all the way the fuck off t-shirt pop up right here. I'll move over to the side so you'll see the t-shirt right there. All right. So just go to situationspodcast.com, click on the merch tab, and then, get your shirt. But yeah, kind of coming back to it, like, Clare, like that is just so amazing. I just want to know, like, adding up all the years, how long did it take to get all of those degrees and certifications?
Oh boy. Okay. Well, I completed my undergrad degree in music therapy, which is a minimum of 4.5 years. You have to complete 4 years of required coursework that pertains to piano skills, guitar skills, voice skills, a lot of psychology prerequisites, sociology classes, mental health crisis and family health crisis classes, musicology classes, music theory classes, music history classes, medical terminology classes, different science and biology, and all the different non-musical but still applicable and relevant and kind of cohesive things that we kind of all mush together in our field.
Wow.
So I did that for 4 years, and then I did a 6-month internship, because part of the music therapy training requirement, educational requirements, is you have to pursue and apply with essays as well as auditions on either your primary instrument, which for me was for 20 years was flute, or with your voice. And then you not only have to write essays to whatever school you apply to if you're interested in pursuing a music therapy degree. But you also have to apply and audition at like whatever school of music. So it's kind of like a 2-tier system. You have to, high school students or adults who are pursuing education later on in life. It's, you have to, just like a lot of degrees, you have to put in different time and work and entry essays and things like that and prove why you're interested in like this major or this field. So I did that, and then I did was able to complete my 4-year degree within the time frame that I was given. Wasn't a super senior, thank God. I was very academically, as a fellow Ravenclaw, followed my academic pursuits and stayed on course. And then I was able to apply and be hired as an intern at a combined program that had 2 different sites. One was a school for autism from preschool through, I think, 22 was the cutoff age for various students. And then I also primarily at my internship site for 6 months worked with adults from 18 through, I think, like early 70s who had various different cognitive and or motor delays, and provide group as well as some one-on-one music therapy sessions and learn different things. And then I was really interested by the end of my internship in pursuing more of music and medicine and music and medical science. So a lot of the things that I was looking into, they wanted a master's degree minimum and different experience in that. So I was like, well, might as well continue with school, and applied and auditioned again, and was accepted into Illinois State to pursue a master's in music therapy. And I got to kind of fine tune and explain in my interviews as well as my entry essays why I wanted to pursue a master's degree in music therapy and how it would benefit me long term, like in my educational as well as professional pursuits. And so I really, there were required classes for grad school as well, but the bulk of my classes I got to pick and kind of fine tune. Okay, I want to go in like the medical field and work in a hospital or a rehab center, or just different various things within medical health sciences. So let me look ahead and look at other veteran music therapists in hospital settings and refamiliarize myself more what they do on their day-to-day life, and then kind of pick different classes that I thought would advance my skill set and what I bring to the table, and help me become confident either applying to already established music therapy programs or prepare myself to create my own and start my own program, which is eventually what I did. So.
All right. We love that.
Yeah.
Love that, love that, love that. And so, yeah, I just want to first and foremost, welcome you all to Situaseans podcast. If you're new around here, this podcast is about dating, relationships, mental and emotional life experiences. Ooh, fucking we. But of course, today we're dedicating this episode to music therapy education, and for you all to kind of understand what music therapy is, and what a day-to-day looks like in Claire's situation as far as her being a music therapist at a hospital. So cannot wait to unpack that. And yeah, I want you all to subscribe to the Patreon, patreon.com/Situaseans podcast. Get all the behind the scenes content, all the exclusive, things that go on there. So definitely subscribe to the Patreon. And we got some promo codes too for the merch and all that stuff. So all the behind the scenes content that you won't normally necessarily get, definitely hit up the Patreon. All right. Awesome. And so, yeah, kind of just going right on in. So, first and foremost, you work at a hospital at Rush University. So for those of you that don't live in Chicago, Rush is one of the biggest hospitals in Chicago. And so it's so phenomenal that Claire has been able to start a music therapy program at a big name hospital, which is a big fucking deal. That's huge. And so
it won a bunch of awards, and it's very prestigious and is always in the top 20, in the country, considered the best medical centers and healthcare centers. And so I'm very, very blessed, and also very proud that I put in a lot of work to start the program.
Absolutely. Absolutely. Like, yeah. And I'm sure that they are absolutely proud of you and all the work that you've done. And so some of you that are watching may be wondering, well, why is there a guitar kind of off to the side? Well, we got a little surprise for you at the end. So definitely, look out for that. Trying to improve your skincare game? Guess what? I got a little something for you. You can improve the health of your skincare with the Vogue approved. Yes, you heard that right. Vogue as in Vogue magazines, the models. Yes, that Vogue. The Vogue approved beauty product, Herbal Face Food, the most potent anti-aging, multi-correction skincare product on the market. Yes. So hit that link in the show notes or video description and use our code SPHFF to get 20% off at checkout. Visit herbalfacefood.com to get started. That's herbalfacefood.com. All right. And use code S as in Sam, P as in pineapple, H as in Henry, F as in Frank, F as in Frank to get 20% off at checkout. That's SPHFF to get 20% off. All right. herbalfacefood.com. Okay. Y'all got the hookup, so let them know that Situaseans podcast sent you. All right. So kind of coming back to the whole Chicago thing, because we're in Chicago, you work in Chicago. Did you grow up in Chicago or like the Chicago suburbs? Kind of just tell us like where you grew up and how those life experiences kind of got you into your passion for music. I want to know how it all tied in.
Sure. So I was born and raised in a West Chicago suburb, LaGrange, that is 45 minutes from the city. I, at a very young age, even before my earliest memories, was told from my parents that I would sing before I would speak. I was very in tune and very attentive to early childhood academic songs like Wheels on the Bus and Twinkle Twinkle Little Star and a lot of stuff that caregivers and parents and grandparents sing to babies and toddlers and young children. And then different music that was on TV for us 90s kids, like Nick Jr. or Nickelodeon, like watching Blue's Clues and loving that show and all the singing that pertains to that out of the box. We were getting a little bit older, but and I was getting more into babysitting territory, but like Bear in the Big Blue House, we're going way back to the to the early Gullah Gullah Islands. Just a lot of really engaging early childhood musically based shows, and then also my parents and grandparents liked quite a few musical theater movies as well. So growing up, I was told that back in the day before DVDs were a thing, when we had VHS tapes, I learned by the time I was in my walker, and I'm sure my vocabulary was very limited. I was able to watch The Wizard of Oz and wait until the credits were done. And then we had an automated VCR rewinder. And then when it was done rewinding, it would pop out. So I learned how to push the tape back in and the movie would restart. So my parents oh, here goes Claire again. We're going to watch Wizard of Oz for the third time today. That's funny. And stuff like that. But anyways, so flash forward, throughout my time in middle school and elementary school and high school, I just every so many years I'd pursue a different music adjacent hobby or club, or I loved my music classes all throughout my academic studies, general music classes. I started actually fell into music. My parents knew that I always loved singing and was very attentive and very engaged and can pick up songs and remember songs very easily. But neither of my parents are musicians, and they're not musically trained, but they love music and they love going to concerts. So they were very inclusive about they're big Beatles fans. When they would drive me to soccer practice or other sports as a young kid, they would have their 70s, 80s, 90s CDs, even the 60s with the Beatles. They'd have Jimmy Buffett. They'd have Billy Joel, Whitney Houston, the Rolling Stones, the Eagles, Fleetwood Mac. And then when I go to my grandparents' house, they'd have their old record players, and they would play Irish music, religious Catholic music, old country music like Hank Williams and Johnny Cash, old jazz music like Frank Sinatra or Ella Fitzgerald. So I was exposed to a lot of like songs from many different generations, from our grandparents' era, from the 50s through the 60s, 70s, 80s, 90s. So, and then obviously listening to things that were popular on MTV or like radio stations. So I was getting all of these different genres and different time periods of music and loving all of it. And my parents actually, through a neighbor, they were getting rid of a wall piano around the time I was in third grade. And so they wanted to spice up our living room with some decor. So they put the piano that was mostly out of tune in our living room. And it was around the time in the late 90s when the Titanic movie had just come out. And everywhere and everyone was playing My Heart Will Go On. So I listened to that song a lot in like second or third grade. And I would go up to the piano and start playing by ear, like My Heart Will Go On or Twinkle Twinkle Little Star or Hot Cross Buns or just different Wheels on the Bus, like different songs that I just heard over and over and over again. My mom and dad are like, how do you do that? And I was like, I don't know. So then they just started me, playing by ear. And knowing that I had a passion at an early age for music, they started me with piano lessons. And then I think not even barely a year later, at my public school, they were offering free music lessons and for children to come up after school a couple times a week to try a violin, try a trumpet, try a flute, try percussion, and see if they were interested in joining beginning orchestra or beginning band. And I always thought the flute was very pretty, especially because Irish heritage and Irish culture is really big, and growing up big in my family, so I'd hear a lot of Irish flute tunes and things like that. So I started taking flute lessons at my elementary school a couple times a week, and was in beginning band, and then eventually intermediate, and then in high school, by that point, after a couple of years of playing, I started taking private lessons and working my way up through different ranks and auditions and getting higher chairs and positions and more solos, and as well as continuing my piano studies. And I also would join different school choirs and church choirs, and then started getting interested in being on stage and doing musical theater because, again, growing up, I watched a lot of like old-timey 50s, 60s, 70s like musicals, Sound of Music over and over again, The Music Man, stuff like that. So I was just I did some Irish dance, I did some hip hop classes, some introduction to like jazz and ballet, and so I was trying to do all of the different fine arts and expressive arts, throughout my childhood and adolescence, and then towards the end of high school, I wanted to pursue, when I was trying to figure out what I wanted to major in college, I didn't want to be a music teacher. I didn't want to conduct band or choir or do any of that. And I didn't have the confidence to pursue like musical theater as well, even though I loved it. So I was like, what else is there that is like music related, that's music adjacent? Because I didn't want to have like a 9-to-5 desk job and just sit at an office computer. And I was lucky because I would have to volunteer through different schools that I went to go to nursing homes or help out to be a tutor in special education or do summer camps, or all my experiences through my youth, as well as my knowledge and interest in many different generations of music, helped me socialize and adapt and make myself, as well as another person that I was interacting with, at ease, whether it be babysitting a child or a toddler and playing little kid songs and singing to them, and they thought that I was fun and felt safe, as well as singing and dancing and performing at nursing homes, and the seniors realizing, oh, this young girl like knows our generation of music. That's really cool, and sparking conversations that way, as well as with our parents, like the baby boomers age and stuff, and being knowledgeable in Motown music and soul music and folk music and classic rock music. So music was not only a passion of mine, but it also was able to really give me a lot of pathways to make connections with all different age groups. And I just so happened to see a news article towards the end of my junior year of high school, an ABC News segment about this senator in Arizona Gabby Giffords, and they had, I think it was like 60 Minutes or something. They had a segment where she unfortunately was shot during a public speaking event by somebody who attempted to assassinate her, and she was in a coma for several months when they had to do a bunch of surgeries to remove the bullet from her brain. And when she woke up, she didn't know how to talk, she didn't know how to walk, she didn't know how to feed herself, she didn't know how to dress herself, she didn't know how to bathe herself. Like all of her daily styles of living are things that a lot of us take for granted. Like she had to start from scratch. So I knew about physical therapy, I knew about speech therapy, but I never heard about music therapy. And a music therapist was featured on that segment, which I watched with my parents, and we were fascinated that I knew music had the power to inspire people or to have a lot of emotional benefits, being in many different facets throughout my childhood and school years in band and choir and theater. I know it had a lot of emotional benefits and can touch people's hearts, but I didn't realize that music can also have positive effects on the brain, have positive effects in movement and speech and breathing and many different parts of the body that people may or may not realize. And so I just decided to take a chance after that segment and look for some schools that had approved music therapy programs. And, you know, it started from there. And the more and more that I learned about what music therapy is and different subfields that we can pursue and different patient populations or clients that we can have, the more I fell in love with it. And like I said earlier, I was able to, by my internship or towards the end of my senior year of undergrad, realize that, okay, music therapists can work in nursing homes, we can work in special education schools, we can work in preschools, high schools, we can work in juvenile detention centers, we can work in psychiatric hospitals, or mental health clinics or private practice. But I just was really interested in hospital settings because I've always loved working with different age groups and bouncing around, as well as being kind of nerdy about music in the brain, and also diversifying like my musical skill set by not being pegged with not only playing children's songs or only playing senior songs or only playing one age group of songs. I like pretty much all different styles and genres of music, give or take. So, and it keeps my music skills fresh by continuously playing different genres and different styles and different decades and learning more about different groups or artists or styles of music that maybe I'm limited or are not super knowledgeable about. I get to research myself about different styles of music or cultural music or subgenres of music and add that to my repertoire and bring more to the table, musically at the very least.
Yeah, that's awesome.
Yeah.
And even just being able to see how you bring music to just so many lives, even in the theater space too, because for the audience here, Claire and I, we actually met doing theater, and whenever we do shows together, Claire, she's brought her guitar and she's played songs, literally like sing-alongs. Like the whole cast would just get together, sing along as Claire playing her guitar, singing like songs from her tablet and everything. It's a whole vibe, and we'll definitely touch on that as well because that's part of the surprise at the end. But yeah, definitely stick around. So yeah, I really enjoyed like hearing how you got into that, like that passion of music therapy, and who would have thought that just a news segment that came about after an unfortunate tragedy led you to this space. So
exactly,
that's amazing. like just continue to inspire, continue to heal, like so many people's lives. Yeah, like we love it. We love it.
Well, thanks.
And so, so you currently hold 2 music degrees. Mm-hmm. Like, well, what area of music, I guess, is like as far as like your focus? Like, did you get to choose that as far? Because like I've never been to music school, so I know nothing about choosing certain like majors or certain areas of focus. How did you come around to deciding? Okay, this is the area of music that I want to study.
Well, every semester within our like required music courses that, were laid out for freshman year, sophomore year, junior year, and senior year, they always exposed us through the music therapy college curriculum, just like teachers or people in medical degrees or nursing degrees or different healthcare professions and service professions. A lot of majors, they have to have like student teaching experiences, sometimes in addition to internships. So for us, we got to my freshman year observe older students at least one to two times a week. We get to carpool and drive to different close by our campus, different clinical sites or partnership sites. So I got to experience like, what is music therapy and how can it be beneficial or useful in nursing homes? What is music therapy and how can it be beneficial in special education? What is music therapy? How can it be beneficial in hospitals, and et cetera, et cetera. So I got to learn different things within observing, and then eventually having to, by my sophomore year, do at least one time a semester, different clinical sites, get to experience different age groups and the pros and cons, as well as the goals that me and my primary teachers would develop, and they would evaluate and supervise and help me fine tune what different music therapy techniques to use for different sites and different age groups and different populations. So I really was able to be like, okay, well, I like all age groups, and kind of forward thinking down my career. I didn't want to be in the workforce for 30, 35 plus years and just be only working with the same age and only singing the same songs and only just being pegged in one or two genres. I was like, well, within different areas that music therapists work with, what can give me a good variety and what can keep me creative and keep me inspired and keep me from ideally, 10, 15, 20 years down the line getting burnt out with singing the same songs or working with the same people or doing the same things over and over and over again. And hospital settings and medical settings are great because I can, bounce around and go into different patients' rooms and work with a variety of ages and sing different genres with every patient that I see, throughout my shift, my hospital shift or my day shift. So it's not for everyone. Some people get overwhelmed within the music therapy field. They only want to work with children, or they only want to work with adults, or they only want to work with seniors. And they only like a couple different styles of music, or they're more comfortable singing and playing guitar and playing piano and playing different instruments with their music skills and their passions. And that's really fine. I've met a lot of like colleagues and other students who were like, yeah, I love children. I would never want to work with adults, or vice versa. I love adults and I never want to work with kids. Yeah. So it's just preference. It's just preference. Some people like the same stability and like going into their day-to-day jobs and knowing what to expect and what to plan and not having to do, outside research or add-ons and stuff. But again, I just like the variety. I like it thrives me to pursue more research studies. It thrives me to continue to attend music therapy and mental health and medical conferences to figure out new health science articles and new studies or new techniques, and how I can utilize that research and those results to enhance and provide more care and more therapy and more crisis counseling and more verbal as well as musical assistance, kind of combining all the things together and just, continue to learn and to grow, even though I'm not a student anymore. And there's always more things that I can learn and new things that I could try. And I don't think I ever want to stop learning new music and new research and new studies and stuff as it pertains to mental, emotional, medical, physical, cognitive, and musical techniques as well.
All right. Love that.
Yeah.
And so, so what does a day-to-day look like for you in your job as a music therapist with Rush Hospital? And kind of just, share with us, like, in what ways do you care for like your patients and help them heal with, their different, I guess, care needs?
Sure. So I My day-to-day schedule, it's kind of changed over the years because when I started the program in 2019, I was only initially hired because Rush University Medical Center, which again is the big prestigious hospital, the business people that I had interviewed with and provided a business proposal and showed scientific evidence-based research and psychology journals and nursing journals and studies on the brain and studies on the body and showing how music and or music therapy can help improve healthcare and improve and enhance other professionals, healthcare professionals' goals. I can assist with a lot of variety of things using my skill set and what I bring to the table. So they were really interested, and I initially was just hired to work for the first a couple months on our adult ICU intensive care units, and then by word of mouth and by positive rapport within the first 3, maybe 4 months, I started receiving emails from stroke doctors and nurses, from cancer doctors and nurses, from bone marrow transplant units, from intermediate care, from all these different places within the hospital and different inpatient units. So by the end of my first year, just as part-time, because they wanted to test out and see if it resulted in positive feedback and positive effects with patients and family members as well as staff, which it did, thank God. I was able to showcase through word of mouth, through people's observations, through positive, feedback or summaries, through my clinical documentation that I would have access to and be able to post on medical records. Other healthcare professionals got to see that, this is the real deal. This is this is a healthcare service. This isn't musical entertainment. This isn't a celebrity coming in and trying to, no shade to some of those people, but we know who you're talking about. who kind of go in and make claims that what they're doing is music therapy when they're not, when they don't have the techniques and the supervision and the license and or board certification to be able to assist people when they're in a crisis, when they're receiving, bedside care or a severe medical diagnosis or terminal illness or dementia or different things. And because music is very powerful and can have a lot of, as I've stated earlier, a lot of behavioral, emotional, mental health, physical, physiological, positive motor effects, but can also be sometimes triggering to people and sometimes can remind people not only of bad or traumatic memories if a song was playing in the background, but also if people are disoriented, whether it's a dementia patient or a patient who OD'd, on a drug and is coming out of it, a patient who's coming out of, side effects of medication from surgeries or anesthesia is confused and trying to pull out their IVs or get out of bed and they can't walk, or they have a chest tube or a catheter and they're incapacitated and they don't realize that they're immobile and they're trying to throw themselves off the bed. I have the training and the technique to try to help de-escalate those situations and figure out what styles of music and what volume and what types of instruments and what genres are most appropriate with those situations and those fight or flight, situations within the hospital. But it's hard for volunteers sometimes and musicians or high school students or professional singers or celebrities who come in and they have a set list of songs and they're, hopefully the bulk of the people that they visit and sing to or perform for are going to, have positive experiences. I really hope for that. But every once in a while, music can, or a certain song or a certain tempo or a certain speed or volume could start, and they might not realize, showing signs or symptoms through their vitals, through their body language, through their affect. Oh, this is making the situation worse. Right. So do I need to make adjustments to the song? Do I need to adjust the speed? Do I need to stop the song altogether? Do I need to pick a new song? These are all techniques and things that we learn in our education, in our field, of what is most appropriate for different age groups, different medical diagnosis, different side effects of medication, and what is given to us and what we have access to on patients' medical charts, as well as discussing and co-treating with other multidisciplinary staff within the hospital. They're extremely supportive and collaborative, and I get to team up with doctors and nurses and physical therapists and speech language pathologists, occupational therapists, social workers, chaplains, like a lot of other bedside service providers who I support, and I believe what they're doing is making a difference, and they've grown to understand what my purpose is and support and advocate for me as well. So it's really nice.
Yeah. Wow. That's amazing.
Yeah.
If you're listening on Apple Podcasts or Spotify, can you do me a really quick favor? Can you please rate and review this podcast? Like hit that 5-star review, because, and I do read all the reviews because this helps me know how this podcast is helping others and how, this podcast is serving you, because my job as a host is to serve you this podcast the way that you would prefer it to be. Are there any common misconceptions that people might have about music therapy, or that they don't necessarily understand?
Yeah, so thankfully, knock on wood, this doesn't happen too often anymore, but there are people who might make pre-assumptions. Like I said, if you see on the news like a musician or a celebrity or a high school music student or a college music student might come in and falsely claim that they're providing music therapy, or there might be certain apps that are saying that we're providing music therapy. But we, in our field, in our profession, have done a lot of advocacy, and also have been working with different state to state music therapy representatives. So I'm a part of the Illinois Music Therapy Association. And so I get to attend like virtual meetings or sometimes conferences or get-togethers and talk about how we can advocate within our state, and make different public settings and different opportunities to spread awareness about what music therapy is and what it isn't, and how certified music therapists can enhance different jobs and different businesses and different professions, as I've talked about earlier. And so we're lucky because we are I think as far as last year, we were able to become the 12th or maybe 13th state in the country through a lot of advocacy, a lot of attending different state meetings, and get enough votes to approve a Illinois music therapy licensure bill, which in the future will be able to not only protect patients from wrongfully receiving claims that people are music therapists when they're not, when they don't have the credentials, or they don't have the background, or they don't have the certifications to prove it, or different businesses or private practices or what have you who are claiming that they're providing music therapy when again they don't, just like every profession, when you work really hard in school and you have to sit for a board exam and you're a licensed professional or a board certified professional, you get very protective of your field, and you want to advocate for it, and you want to showcase that all of your training and all of your hard work and all of your sleepless nights, like you're passionate about your field, and other people who didn't put in the work per se,
Right.
you don't want them stealing your thunder. Like I would never go into a medical room and be like, well, I'm a nerd and read a lot of like medical health science research books, so I'm a doctor now because I know more than the average medically licensed trained professional. Like that's, to me, that's can be kind of insulting, or to people who have worked really tirelessly in the medical field or even the teaching field. Like I would never claim to be a teacher because I don't have a license in teaching or education. So this bill will protect Illinois music therapists to be able to have not only legal ramifications for people who are falsely like claiming that they're providing music therapy when they have no evidence to showcase that they're licensed or certified, but also protect the public as well. Because some of my colleagues who do private practice through their homes or travel to and I've had experiences doing some private practice as well, travel to people's homes, and provide one-to-one services. People's condos or apartments or homes can also receive the services that they signed up for and the contracts they agreed upon, and not have any falsification or people claiming to be something that they're not. So it'll protect the public, and it'll protect our clients and our patients as well. And hopefully be able to provide more opportunities, in the next couple of years for more music therapy programs to start, whether that be in school districts or other hospitals or outpatient rehab centers or mental health psychiatric programs or nursing homes or hospice. Like, once the public is more aware and continues to become more aware of what music therapy is, and that it's a evidence-based, approved profession, approved mental health service, that people will be able to advocate and champion and speak correctly about and understand, again, what music therapy is versus music entertainment or music performance or music teachers or dance teachers or all the different subfields within music and fine arts. That there's a lot of different, just like there's music therapists, there's art therapists, there's dance therapists, there's drama therapists, and they are also have to take certain classes that relate to their specialty expressive arts field, and also have to sit for board exams as well, and have to do so many clinical hours of training and testing, and to make sure that their skill set, or they're the best, they're accurately prepared to provide the correct service and be able to do an outstanding job within their training in their field.
Yeah.
So.
Wow. Love that.
Yeah.
And so you started the music therapy department at your hospital. So Rush has never had this before, and you piloted this with your hard work and efforts. And so, what can other hospitals and institutions do to kind of pretty much follow what you did, and how can they get involved in and start their own music therapy at their different, institutions or schools, like other hospitals, care facilities? How can they do it?
Well,
how can they get a Clare at a Clare like you at their institution?
Well, I actually was asked to do a seminar, a lecture for one of my old previous college professors who works at a university in New York now, and she was very proud and very sent me a lot of emails and positive feedback and messages about successfully on my own getting my foot in the door and getting interviews and being able to prove my service and prove my worth, and eventually after a couple of years get enough evidence and enough positive feedback to become full-time and continuously expand and grow and work in more inpatient units. And now I'm working pediatrics and soon in the NICU, and I'll cover all inpatient units, and then hopefully in the future be able to do some outpatient programs in our outpatient cancer centers and ALS and dementia research, and collaborate and do more medical research studies and etc. But anywho, it's a tough road. It's one that you have to be really confident in what you bring to the table for other music therapists or art therapists or drama therapists or dance therapists. You have to be able to put in a lot of time and effort into your business proposal and be able to clearly and concisely state your professional mission statement within your field, expressive arts therapy field. And then also be able to summarize within your business proposal, like what services or what goals you can provide. So for us, we help explain to the public too, within my hospital music therapy program, I always explain to doctors and staff and patients and visitors that I'm using different music techniques and therapy techniques and different foundational techniques to try to elicit non-musical goals. So if I'm working on a patient and trying to encourage them to play the drum, or I'm holding up the drum and moving it around like a side to side, their peripheral vision, or up and down, I might be working with a stroke patient and be testing their hand-eye coordination or their muscle strength and trying to encourage them to look to a certain side if their vision was affected by their stroke, or be able to see how long or how many minutes they can grasp a drumstick or a maraca or a shaker, or how many minutes they can engage with me in music playing and not feel tired or feel burnt out or feel depressed that their hand or arm strength or their neck strength or their body is worn out from a really debilitating traumatic event, a car accident, a seizure, a stroke, cancer, surgery. So I'm trying to use my skill set, and again, different music techniques, songwriting, dance within, music, instrument playing, breathing, meditation, a lot of different music therapy interventions to try to help somebody with their other treatment goals, whether that be like if they're depressed, with their recent diagnosis or long-term stay, trying to help them cope with their illness, trying to provide bereavement support for patients who are at the end of life and honor them through cultural music or religious music or music that pertains to their partner and what's important to them, playing music to, stimulate and encourage newborn babies to learn and grow, especially sick NICU babies who are more at risk the longer they stay in the hospital for getting, developing a cognitive delay or an educational delay because they're not getting exposure to different senses and different stimulation. We're trying to prevent that through specific sounds and speeds and volume of music. And again, like I said, that we're using music to facilitate non-musical goals. And I really had to do a lot of presentations and public speaking events and really hone that in and prove that, hey, I'm not here to play lobby music at your hospital. I'm here to try to make this your first and foremost your whatever your treatment plan for each individual patient that I'm assigned to work with or referred to work with. Try to provide at the very least their hospital and the quality of care to have a better hospital experience and better satisfaction, but more importantly, try to see what diagnosis they have and where they're at with their is it just to provide distraction or pain management? Are they not going to get better? Is it a terminal illness? Is their health declining rapidly? What can I do within my scope of practice to make their stay more comfortable and make it less scary and less frightening, and also provide reassurance and make family members who have to be at the bedside of a dying spouse or parent or grandparent feel empowered by singing and honoring their life and talking about songs that are important to their family, important to their culture, important to their religion, and just also, enhance patients who might not trust their doctors or nurses or have bad hospital experience in their past feel more at ease by being the middle woman or middle person to be like, hey, I'm not going to come in your bed. I'm not going to poke and prod you, or I'm not going to, come and do certain things that you might expect of me. I just want to play at the very least a few songs for you and see if your heart rate decreases or your blood pressure stabilizes, or your scale of 1 to 10 of pain goes down to at least, 6 or a 5, or you feel more at ease or more calm after we do a music meditation, or I find songs that can be relatable to people's experiences and people's trauma, and they feel validated through that. And just there's a lot of different ins and outs and tricks that and techniques, I should say, that I've learned to help quality of care as well as staff members realize, oh, okay, yeah, the patients, like, they're a lot more calm, or they're not trying to pull out their IVs anymore, or they're not yelling at us anymore. Like, they're super happy after Claire leaves, and we have a better patient care, doctor, nurse patient rapport. Like, it makes the staff happy too. And staff members, if they're working with delirious patients or Alzheimer patients or kids who are crying or screaming, they can get burnt out and they can feel stressed. So sometimes if it's appropriate or there's not a lot of noise in the hallway, I'll crack the door open so the music can emulate down the hallway while doctors and nurses are doing dressing changes in other rooms, or their documentation, or grabbing other medical supplies, or wipes, or gowns, or pillows, or bed sheets. And at least once a day, I always get staff members, doctors, nurses, medical students, janitors, food service people, nurses, aides, they're like, your music makes me so happy, or you just brighten my day with your music. So it has like, those aren't my goals to, I'm trying to improve the patient's goals, but it's nice. It's a nice added bonus that the staff members, like, they get happier and they feel less stressed, or their day-to-day work life improves when they hear live music, or hear the patient singing or dancing with me, or hear the patient stop screaming or crying and calm down, and it calms their nerves and makes them happy too. So
wow, that's amazing, Claire.
Yeah,
making a difference out here, doing the Lord's work, as they say.
Situaseans podcast is an open platform covering dating, relationships, mental and emotional life experiences. If you are looking to advertise your brand or product, or would like to sponsor the show, send an email to situaseanspod@gmail.com. That's situaseanspod@gmail.com.
Yeah, is there anything additional that you would like to share with the audience about music therapy?
Yeah, so I have a lot of anecdotal stories, too many to count, but just to highlight a few, which I think that your viewers and audiences members would like to be interested to know, is I've been able to work not only to provide music and be honored. Those days are hard. They're not every single day, but be asked by family and staff to sit at a patient's bedside until they take their last breath and honor them, honor their lives, and honor their, like I said, their family or their partnership through music and representation and reflecting who they are or who they were. But I also am able to find and create songs to celebrate somebody when they're cancer free, or when they finally get to leave the hospital. Like, you get to leave today. Thank God you've been here for months or weeks, and it's just very taxing. And it just honor them, that they've made it, that they've come over the hill, or they've went through that there was a light at the end of the tunnel. But I have so many beautiful stories and touching stories, but one that a lot of people are like, wow, that's amazing, is that I've told a handful of times. I've worked with a couple of comatose patients who are obviously intubated. They are on a lot of respiratory and breathing machines. They're not able to open their eyes. They're not able to move. They're not able to communicate verbally or non-verbally at all. They can't read or write, nothing. So I have visited a lot of those patients, and I'll try to come in and provide, if I'm able to interview their family members, like music that the patient likes the best, or makes them feel most relaxed or more calm or most preferred. But if they don't have family members there, I don't know. I just have to, figure out other things or do some research. But anywho, I've been able to sing to patients, and over time they've gotten better and were moved to our recovery floor, and they'd never seen me before. But they, and the doctors and nurses, when they were super sick and on some of them on death's door, they kind of looked at me like, oh, I wonder if she's just, wasting her time, like singing to this person who probably doesn't even hear her. Those patients did, because when I introduced myself and I would start singing to them, a light would flick in their mind, their eye, and they'd be like, oh my gosh, I've never seen you before, but I remember hearing you come and sing to me. And I had one religious patient say that they knew they weren't going to die in the hospital because I would sing religious music to this person. I had another patient who could hear everything that the doctors and nurses were saying, who said, you were the hand that lifted me out of the darkness and gave me hope that I wasn't going to die in this hospital. And I've also thank you. And I've also had patients who had a lot of medical problems going on, who were at suicide risk, who told me and or hospital staff that, like, I don't even want to live anymore. And through different time spent with them and different connections and different mental health music that I would utilize and engage with them and build that trust and build that support, they were able to tell me, because of you, I don't want to kill myself anymore. Like, I have a newfound reason to live. So that's super.
Oh my goodness.
That's super rewarding, and I'm very appreciative that I was able to build that patient therapist like rapport and that trust and that foundation with so many individuals, and then also able to like I said, provide different music-based, medical/mental health-based sessions and services, and help people who, after they had a hip replacement or a knee replacement or a stroke, and they are depressed and aren't walking or moving as fast as they could, be able to team up with physical therapists or occupational therapists and use my my instruments, my percussion instruments, or my songs, or my live music and preferred music to give them motivation, to give them auditory stimulation to be able to walk at a certain speed or move their feet at a certain speed or lift their arms at a certain degree or a certain number of times. And music is so beloved worldwide, and in so many different cultures and so many different age groups, that people just get inspired and get motivated when they hear their favorite song or their favorite style or music that means a lot to them. So again, I try to, if people feel depressed or feel like there's no hope, I try to figure out, based off of where they're at and what they're dealing with, what music can serve them the best and give them newfound inspiration or hope. And I've been able to, through combined co-treatment sessions, been able to help patients walk more for longer periods of time, have more of a steady balance, have better arm and leg strength. And then also for patients who have had trauma in the brain or trauma that affect their speech, been able to write songs or rewrite songs with familiar melodies to help relearn or reteach them words and sounds and vowels and consonants through therapeutic singing. And just like I mentioned earlier, decrease or improve stabilize vital signs, provide relaxation and distraction for bedside procedures through IVs, through chest tubes, through dressing changes, things that the patient has to be awake from that can be very painful and very scary and traumatic, and just kind of alleviate some pain, alleviate some stress, and just help them deal with a lot of different stressors internally as well as externally that are going on when they're at the hospital, and just try to help out in whatever way I can.
Wow.
Yeah.
We love that, Claire. Like, thank you for being you, and thank you for helping to heal so many patients. Like, I know that you've definitely changed and made an impact on hundreds, if not thousands of lives of people, of all the patients that you've had, whether at Rush and even like the people and the clients that you've had even before your time at Rush. So I think I speak for everybody when I say, like, continue to do what you do, and thank you for your service.
Oh, thanks. Yeah. I love my profession. And like I said, I wanted to pick a field and a job that I felt inspired and felt wanted to go to work and not, and they always say one of the sayings is, if you love your profession, you love your field, it doesn't feel like work to you. And I always thought that sounded so corny, but it really does. Like, I'm really lucky that through my hard work and time and confidence and not fear of public speaking, and be able to speak to a lot of different age groups and large groups of people, that I was able to prove my worth and get a lot of people to understand what my field is and speak positively on my behalf and educate others. Like, a lot of staff members now that I've worked with for 5 years are able to articulate and correctly explain like what music therapy is and how it can assist with their medical care. And I got to take off their training wheels, and they get to advocate and speak. I feel really honored and really lucky that I have over 300 staff members who every single day will compliment me, will thank me, will tell me what a great job I'm doing, or what a beautiful voice I have, or you're amazing at X, Y, and Z. And it's nice to feel appreciated, not only by like patients and visitors, but also by staff, and feel a community and feel like what I'm doing is eliciting a lot of positive responses, and like you said, making a difference. And hopefully at least every day that I go to work, at least one person's life, if not, more. I try.
Absolutely. So, of course, at the time of this recording, we're in June, but we always record in a time machine. We record in advance. So by the time that this episode comes out, that you all listen to this is Wednesday, September 25th. So I heard from you, Claire, that there's actually a music therapy day. Can you share with us what day does that happen?
So now we actually get a whole week because it's April 10th through 15th is World Music Therapy Week, and we get to be able to. We try to during that time get different social media and public and digital awareness through if we get approved patient or client consent forms, if we're able to give snippets of our sessions or pictures of clients or children or adults or babies or family members that we're working with, and showcase like through different forms of videography and photography, like what we're doing, and sometimes we get interviewed.
Yeah,
sometimes
exactly.
We interview staff. Sometimes we interview families. Sometimes we review our clients or our patients, and we also get to give snippets of prevalent research. A lot of music therapists within our field like to engage in at least 1 to 2 research projects, and some of the veterans who have been in this field for 25, 30 years get to get their publications published on medical journals or psychology journals or nursing journals, or we have a professional journal of music therapy publication, as well as musictherapy.org if you want to learn more information.
All right.
That's our American Music Therapy Association professional association that has a lot of more information and a lot of specifications, and like I said, a lot of prevalent research that the public can look into if they want to learn more about what music therapy has been doing, and more, as I've talked a lot previously about a lot of different positive results and effects that music therapy can have. So yes, April 10th through 15th is Music Therapy Week, and I encourage each of you during that week or that time to check Google, check Facebook, check Instagram, check LinkedIn, different social media websites, and see what music therapy is.
Yeah, absolutely. You all get involved. Do get involved. So yeah, Claire, as you know, of course, on this podcast, of course, we talk about dating, relationships, mental and emotional life experiences. But of course, this episode we're dedicated to music therapy and life experiences. So this is the life experiences kind of like part of the episode. But as my listeners, they love whenever I unpack like fun, cool little hinge or unhinged, prompts. And so I got a couple that I wanna that I think are very cute, and that kind of ties in with just like fun happiness. Are you ready to unpack these with me?
Sure.
All right, let's do it. All right. So this first one says, I'm convinced that dogs are the best people. This is so adorable. Is this hinged or unhinged?
Well, I am another passionate love of mine. My 2 favorite animals are bottlenose dolphins and dogs. And I have by the time this podcast comes out, she'll be 5. I have a 5-year-old golden doodle named Miss Penny Lane.
Aww,
and I don't have any human children of mine, but she's my fur baby and will always be my fur baby. So dogs for sure are the best. Super hinged. I love all dogs. I want to pet all the dogs. I want to say hi to all the dogs. My dog also, a lot of those of you who might not know this, but a lot of poodles and doodle adjacent breeds, when they're happy, they actually smile. So when I first adopted Penny when she was a puppy, I learned, because I got to meet her poodle dad and her golden retriever mother, that her poodle dad would smile for treats, and Penny innately, whenever I would try to train her, would also smile for treats. So when I take her on walks and I tell family members and children that she's friendly, and people are like, she's showing her teeth at me, I'm like, no, she's smiling at you. She's super happy. So she smiles, she wags her tail and her butt.
She's the most, she's definitely adorable.
Sean loves Penny.
Oh yeah, Penny is so adorable.
Just like I love Miss Harley.
Yeah. Speaking of which, Harley, come here, girl. Come here, girl.
Come here, Harley.
Yeah. We want to come here. Come here.
Come on.
Yeah, come this way.
Come here. You want to play?
Come here, girl. Come here. Come here, girl.
Come here.
Good girl.
Come here, Harley.
If you're looking at the if you're looking at the Harley cam, Harley, she's over here. She's just chilling out. But Harley agrees that dogs are the best.
Exactly. I love dogs.
So this last one says, I get along best with people who think Starbucks is better than Dunkin'. So as we all need our coffee as part of our daily routines, I'm not a coffee person, but I understand the whole coffee craze. But like this prompt says, coffee, I would get along best with people who think Starbucks coffee is better than Dunkin'. Is this hinged or unhinged?
Well, as my close friends and I like to ask each other a similar question, are you a Dunkin' daddy or Starbucks mama? That's the slang. That's all the cool.
What the cool kids are saying.
Cool kids say.
The Gen Z kids.
Are you Dunkin' daddy or are you Starbucks mama? People will judge you based off your answer.
You're right.
I don't know. I go back and forth. I feel like, because I'm not a coffee drinker either. I used to really love those cold Starbucks Frappuccinos, which are pretty much like low caffeine, milkshakes or whatever. I don't have too much of those these days because dairy upsets my stomach. But I like oat.
I feel you there.
I like oat milk though. But anyways, their prices I like Starbucks, and I like that they have a few more like options as far as Dunkin'. It's mostly like the donuts and stuff, give or take, although they're expanding. I feel like because of the price, the prices and stuff, because Starbucks, they're things I like about Starbucks and things I don't. The last year, I've converted to more of a Dunkin' daddy. So unfortunately, whoever wrote that, I think I'm sorry. I'm team Dunkin'. I'm not as much team Starbucks these days, because again, I don't a lot of their I like their dragon fruit lemonades, like when I want a sweet treat, but again, too much sugar causes me to get acid reflux, so I also have to be careful. But what I like about Dunkin' is that you can get these. My favorite drink there is, for those of you who might have not tried this before, I recommend their mango pineapple or mango lemonade, something like that. It's like two different things. I love mango flavored drinks, but you can get it mixed with green tea. It's mango. I think it's mango pineapple refresher, and I get it with light ice because sometimes they can overkill with the ice and you don't get as much of the beverage.
Please try again.
Oh, Siri. Siri, she has input too.
I guess. I don't know, but I'm curious to know if you're a Dunkin' daddy or a Starbucks mama.
I'm a Starbucks mama all the way.
Of course, Mr. Bougie.
Yeah, the pumpkin spice frappuccinos. That's what gets me. That's the only coffee adjacent thing that I like is Starbucks is the frappuccinos.
I do love their cake pops there too.
Oh yeah, for sure. Those are good.
They're cake pops.
So Dunkin' and or Starbucks, sponsor the show. Like Dunkin', if you want me to be a Dunkin' daddy, sponsor the show.
You'll convert to whatever.
I'll convert real quick.
You're a drifter. You'll drift whatever. You'll lean whatever way.
Exactly.
Whatever corporation sponsors you, you'll be like, that's my favorite place. I eat there every single day.
Exactly. Thank you so much to the listener for submitting your, hinge or unhinged, like prompts. We love those. Again, if you want to get involved with the show, submit your stories, your questions, even your hinged or unhinged prompts to situationspodcast.com/submit. We love unpacking that. And yeah, those are really good. Like I think those were definitely good and cute prompts. Thanks for submitting that. So Claire, it's time for the big surprise that we've all been waiting for on the show. Thank you first and foremost, thank you so much for educating us all about music therapy, getting us all up to speed. Now we have the tools necessary to reach out to a music therapist, hug a music therapist, I'm excited. So yeah, you have a song prepared for us that you're going to perform and sing on your acoustic guitar for our audience to kind of give them a little bit of a demo of what music therapy looks like and what you do and how you help us heal. So what song do you have picked out for us?
So a song that I kind of came back into my knowledge or awareness actually was a song that was featured on one of the Hunger Games movies around 2012. And it's by a folk group called the Secret Sisters. It's called Tomorrow Will Be Kinder. Right. And you'll soon find out, but it addresses a lot of has themes of mental and emotional health and motivation and beautiful lyrics as well as beautiful melody. And it can be applicable to a lot of different age groups and a lot of different hardship and trials and tribulations from various people and various ages and backgrounds that I meet in the hospital. So I love this song, and a lot of people have never heard of it or heard it before. And they think it's beautiful, and they feel really like a personal, feel like it can relate to them and whatever. So if you're ever struggling with grief and with loss and with medical issues or financial issues or relationship issues or different, ups and downs or stages of life that we all have to go through, this song hopefully gives you some hope and gives you some motivation and is a reaffirmation that you will get through whatever you're dealing with.
Love that. Well, as someone who's never seen the Hunger Games, I am so interested and cannot. I know, right? I know. I'm so. I know, right? Yeah, I got to get on that.
Oh my gosh.
Well. By the time this episode comes out, I'll be in California, so maybe I'll have time to sit down and watch the Hunger Games.
You're too busy watching all your cop shows,
right? I know, right? Law and Order, exactly. I know.
You didn't get into the different pop culture phases of the Twilight movies or Harry Potter or the Hunger Games or different book series that all the fans got into when the movies came out that kind of was off your radar. That's all right. I won't judge you that hard.
All right. So we're going to go ahead and we're going to get right on into Claire's performance. So stick around. All right. So Claire, she's about to perform her song, or not her song, but the song from Hunger Games.
Tomorrow Will Be Kinder.
Tomorrow Will Be Kinder. All right. So let's get right on into it. Claire, it is all on you. I am so excited. Let's do it.
Black clouds are behind me, and now I see ahead. Often I wonder why I try, hoping for an end. Sorrow weighs my shoulders down, and trouble haunts my mind. But I know the present will not last, for tomorrow will be kinder. Tomorrow will be kinder It's true, I've seen it before. A brighter day is coming my way. Yes, tomorrow will be kinder. Today I've cried so many tears, and pain is in my heart. Around me lies a somber scene. I don't know where to start, but I feel the warmth upon my skin. The stars have all aligned. The wind has blown, but now I know that tomorrow will be kinder. Tomorrow will be kinder. I know I've seen it before. A brighter day is coming my way. Yes, tomorrow will be kinder. A brighter day is coming my way. Yes, tomorrow will be kinder.
Oh my goodness, that was amazing. Wow, wow, wow. Wow, 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 wow.
Thank you.
Oh my God, Claire, that was amazing.
Thank you.
Wow. And I hope that you all enjoyed that as well. And, and I hope you all can now see a little bit of what Claire does as her job as a music therapist. And that song was just so healing.
Oh, thank you. Thank you. And if any of you are interested in additional options besides clinical talk therapy, which shout out to clinical therapists as well. I have some friends who are clinical therapists, but if you want to, if you feel like music or dance or acting or different expressive arts therapists might be a good assistive therapy and therapeutic resource for you, I encourage you to go to our musictherapy.org website and search your state and your zip code and see if there's any private practice music therapists near you that you can have one-on-one music therapy, dance therapy, art therapy, drama therapy. If you feel like those can be assistive to your mental, emotional, spiritual, different health aspects of your life and can enhance your life or enhance your son or daughter or grandparent or parent or sibling who might have a disability or might be going through depression or trauma, like you can have your own private practice expressive arts music therapist, dance therapist, drama therapist, art therapist as well. So yeah.
Thanks for sharing all of those resources and that knowledge with us.
Of course.
And thank you for sharing your kindness and generosity and your love of music with the show and with this audience.
Oh, thanks.
I like that. Yeah, I know for a fact that everyone listening and watching really enjoyed this. I know that I did.
Well, thank you. Thank you. Yeah, it was a lot of fun. I like getting to tell people who might not have heard of my field or didn't even know music therapy existed that it's out there and it's making an impact on different communities and different businesses and different people's lives. So.
Absolutely. And I just feel so privileged as a podcast community that like we recently had on a EFT and a psychotherapist like practitioner, and now we have a music therapist. Like we're getting to learn so many different facets of therapy. So Thank you for being part of this show's growth.
Of course. Maybe in the future you can get an art therapist, a dance therapist, a drama therapist, and they can bring a little snippet of their specialty and their training.
Absolutely. I'll collect all the therapists like Thanos collects his Infinity Stones.
There you go.
Be the Avengers of all the therapists. Love that.
Exactly.
Yes. So yeah, if you all want to get involved with the show, again, submit any of your submissions to situationspodcast.com/submit. That's the first way. The second way is to email the podcast, situationspod@gmail.com. And the other way is to call the hotline, 312-586-2664. All right. So there's 3 ways that you can submit. And whenever you submit, it is like a drip of love onto my heart. It's been a while since I've said that. So whenever you do that, it's a drip of love on my heart. So drip, 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 submit, submit, submit. Awesome.
There you go. You got to write a little tune for that.
Exactly. Right. I'll have to call up on you since you have the guitar and everything.
Oh, we can team up. He's a musically inclined as well. So you never know. You never know. Maybe I'll make a reappearance.
Exactly. Yes, we would love that. Well, awesome. If you are in a boat, a plane, a train, if you're in the third dimension, or hey, you could possibly be a client or even one of Claire's colleagues. You could take Situations podcast with you wherever you go. We are on Apple Podcasts, Spotify, Google Podcasts, wherever you get your podcasts. And I will see you all back here for the next episode in a couple of weeks. Woo!